So Shri Arun Firodia, Dr. Jayashri Firodia, Dr. Mashilkar, Dr. Bhatkar, Kiran, Tessie, everybody here, thank you so much for the honor that I've just received. I thought I would do my lecture a little bit differently with the idea that while I was asked to talk about handling viruses, I wanted to communicate with all of you that everybody in this audience is a scientist. If we can frame the right questions, we know we will understand how to answer them. So over the next 10 minutes, I want to take you on a little journey with me about what we will do when we have the next pandemic. And basically, when you think about public health, it's called public health for a reason. It is something that affects all of us. And if we are to do that, we need to understand, is there a problem? How big is it? Are there solutions? What do we need to do to make them work? Are they working? And what do we need to make sure that it doesn't happen again? So I'd like to start with, is there a problem? Suppose there is a new disease, will you recognize it? Let's say all your friends you go to a wedding and everybody comes back with diarrhea. Is there a problem? Well, it's likely. In your neighborhood, people start to have lots of respiratory infections. There is an outbreak of fever. Is there anybody who hasn't seen those patterns? We've all seen them. It's just that we don't always think that this is a problem. When does the problem become a true public health problem? It comes from when these cases are really sick. If it's a diarrhea that resolves in 2 days, nobody cares. If it's an outbreak of cholera or of hepatitis that is affecting 10 or 20,000 people in the city, now you have a problem that needs something to do about it. So basically, if you have prepared clinicians who can share information with public health authorities, that actually tells you that there really is a problem. So the 3 characteristics of any pathogen that determine whether it is going to be a problem is, does the disease make you really sick? Does it spread from people to people? When it affects people, does it affect everybody or just some people? So let's say it's something like influenza. If you've had influenza before, you won't have it again, right? So these 3 characteristics, if you think about SARS-CoV-2, did cause very severe disease, pathogen we hadn't seen before, very transmissible pathogen until we got to Omicron where severity came down, transmission went up, but the susceptibility of the population changed, so now nobody wants to worry about SARS-CoV-2 anymore. So when I show you a graph like this, immediately, this is just counting cases. If we learn to recognize patterns, then we begin to estimate whether there is a problem, how much of a problem, and already this is giving you ideas about what kinds of solutions you might be thinking of. This is an example of measles. You see that there is one case first, then there is a small cluster of cases, and then there's a bigger cluster of cases. Why is that? Because this is secondary transmission. The first cluster contributes to the second bigger cluster, and the third one would be even larger if everybody was equally susceptible to the disease. But because people are vaccinated, or you can introduce vaccine quickly, you can stop the cluster. The next question is, how big is the problem? So what are the numbers? How quickly are the cases happening? What's the distribution? So what I'm showing you here is a comparison between the US and India across the SARS-CoV-2 pandemic, which is shown by the number of cases. Do you really think that in India, with our 1.3 billion people, we actually had fewer infections during the Omicron wave than in the US, which has 1/4 of our population? It's not possible, but based on the data, that's what we see. So when you look at patterns and you begin to question, how big is the problem? Is this really showing what I expected to show? You're well on the way to becoming a public health scientist. And the value of maps for disease, worldwide maps, maps of a city, the control of infectious diseases started with John Snow and a map of 5 streets that showed you where cholera was occurring in London 150 years ago. So the next question is, are there solutions? Everybody remembers 2 meters, everybody remembers hand sanitizers, some people still wear masks. These are public health measures that depend on disease transmission. Before we knew that SARS-CoV-2 was actually capable of spreading across wide distances, we thought that the 2-meter distance was going to protect us. We thought the hand sanitizers would protect us because if somebody coughed, the virus would land there and we would touch it. Now we know that that is not true. It's a virus that can persist for much longer. So actually, rather than a hand sanitizer, a fan makes more sense. So knowledge evolves, solutions evolve with time. And then you have to think about what are the treatments for people who are sick. You remember we heard of hydroxychloroquine? Anybody using hydroxychloroquine today? Well, it was based on the principle that hydroxychloroquine was an antiviral in cell culture studies. It didn't hold up when it actually got into people, but we had to do that testing to find out. And then we found out that steroids really worked. Steroids became a mainstay of treatment, and deaths due to SARS-CoV-2 really crashed. Then we have to think about how do you prevent transmission, how do you prevent illness, and that's where the role of vaccines comes in, as well as the provision of high quality care. What's needed to make them work? I think you often forget that people are really important. So you may remember people flooding into ICUs. But where are the ICU doctors? You cannot create an ICU doctor on the same time frame as the pandemic evolves, or an ICU nurse. So you have to create the people before you need them. And then, of course, you need resources, you need policies. We had PSA plants being installed across the country, but most of the installations happened after we ran out of oxygen. So planning ahead, making sure that resources are in place are very, very important. But policy matters the most. If you remember all the messes that we had with vaccines, the idea that states were going to buy their own supply, that private hospitals could buy part of the vaccine supply, healthcare policy affects us all, and making sure that our leaders make the right decisions is more important than anything else. Resources can and will be found. CSR funding supported a lot of activities during the pandemic. So one of the things that we should take away is that we must ensure that we don't repeat mistakes. If we learn anything from the pandemic, if we need to learn how to handle viruses, we should make sure that health policies are driven by science and not by convenience. Finally, I think it's really important that we measure whether what we are doing is working or not. I want to share with you the first graph here. You can see the blue and red lines. That's the mortality rates before and after steroids. Before you had steroids, it's the blue line. Once steroids came in, the deaths almost halved for people who were in hospital. If you look at the data on whether vaccines were working or not, I'll show you two pieces of data. The first graph is from the Ministry of Health website, which compares deaths in people who have been vaccinated and unvaccinated. What you see in the red line, the big mountains on top, in case you can't see the lines, is unvaccinated people. The message is very clear. If you are unvaccinated, you will die. Okay? The next message is in the bottom graphs, which is data actually from other countries which show us that vaccines stop working so well. And that's what tells us when you need a booster dose. Unfortunately, we don't have this data in India, and that's why there continues to be a controversy about when should we boost, what should we boost with, etc. So for public health scientists, ask for evidence before decisions are made. So finally, what needs to be done to stop it all happening again? I think the most important word on this slide is preparing society. Pandemics affect us all. Pandemics require all of us to work. Preparedness means that we need to play a role in whatever comes next. I hope I've spent the last few minutes just walking you through that pandemics are not hard to handle. All we need to do is make sure that we ask the right questions. Thank you.